Zika virus continues to be a concern this summer, especially for pregnant women. Season's OBGYN joins us with more on why it's so important to stay protected from Zika. Dr. Amy Miller is here with all the details. Welcome. We have so many questions. I know women my age, women of all ages, and husbands, and everybody has a lot of questions about Zika. Very prevalent right now. All right, so tell me, how is Zika transmitted? Should we be concerned here in Charleston?
Well, the important thing to know about Zika virus is it's currently active outside of the United States. In general, the Zika virus is currently being transmitted in countries south of the United States.
Okay.
So Mexico, Central and South America, the Caribbean, and some of the U.S. territories. It's really important to know that there's nothing actually active here in South Carolina. Although there have been 7 case reports here, 6 of them were due to travel outside of the United States, and 1 was sexually transmitted.
So there are different ways of getting it then?
Exactly, and that's important to know. So the most common way of transmitting Zika virus is with a mosquito bite from a very specific type of mosquito called the Aedes species mosquito. That mosquito is found in southern United States, but again, currently our mosquitoes do not carry it. The second way of transmission is through an infected male to his sexual partner. And then as an OBGYN at Seasons OB, I am most concerned about something called vertical transmission, and that's where a pregnant woman can transmit the virus to her unborn baby during pregnancy or around the time of birth.
So Zika, is it something that we should be concerned about if there's no sign of pregnancy, if nobody plans on getting pregnant? What's the issue with Zika other than that?
Yeah, that's a great question. If you are not planning pregnancy in the next 6 months, you don't really have a concern. The Zika virus itself passes a very mild illness in general. Symptoms are mild and going to be things like maybe a fever, a total body red rash, joint pain, maybe some conjunctivitis, which is where the white of your eye looks a little bit red. So symptoms are very mild. There have been some case reports of something called Guillain-Barré, which is a neurological condition that can be passed through viruses and can cause temporary paralysis, but that's extremely rare.
Very rare. Okay, but for babies, it's a whole different story.
Exactly, and that's where we as an OBGYN community want to get the word out about Zika, because we are starting to see it in South Carolina, but again, through travel and sexual transmission.
So what are the effects on a baby?
So if an infected mosquito were to bite a pregnant woman, if you were traveling in these areas, you might present with a mild illness. And if that virus is able to affect the baby, there are some birth defects that are now being reported. The birth defects that we're seeing are very serious birth defects, which could include microcephaly, which is poor growth of the brain or neurological tissues. It can cause hearing loss, blindness, and to be honest, we don't know the full extent because, again, this is very new.
So what can we do to protect ourselves? It's scary to think that this is something that we could pass on to a child.
Exactly. I think first and foremost, it is really important to know that there is no treatment, and so prevention is the key. We hope that someday there might be a vaccine.
I was going to ask about that.
Right.
Where are we with that?
And so the CDC and the local health departments are working very hard to develop possibly treatment or even vaccines for this. There are similar viruses like dengue, yellow fever, Japanese encephalitis that actually do have vaccines for them, but unfortunately there's nothing for Zika. So the primary treatment is prevention. So the first thing that I share with my patients is I let them know if they're considering conception, meaning conceiving a child within the next 6 months, I advise that they do not travel to the CDC designated areas where the virus is active. The reason we have 6 months we can get into in a few minutes. But the second thing I tell them is if their partner has traveled to any of the CDC Zika infested areas, that they should refrain from sexual activity and conception for at least 8 weeks if there's been no symptoms in their male partner, or 6 months if there's been any type of symptom with their male partner.
So tell me real quick, we don't have a ton of time. What is the 6-month period?
How did that come to play? So what we know so far is that the virus itself is active in the bloodstream for a specific period of time. That's called viremia. Once you're bitten, it takes the virus of incubation of probably a few days to up to 2 weeks, and then you might distribute mild symptoms for about a week. That is when the virus is most active in your bloodstream, and then it takes time for your body to build immunity or proteins to protect yourself. That is blood. But what we found out recently is that the virus is also active in seminal fluids or semen, and in fact much longer than in the blood.
Okay.
There are only actually 5 case studies of this in infected males who have traveled, so we don't have a lot of data. But they followed someone out more than 62 days, and so they're looking at kind of the half-life of the virus and saying that if your partner, your male partner, has traveled to these areas, probably safest to wait 6 months prior to conception.
All right. Sounds like there's still a lot to learn about Zika, though, and we can talk to you about it. Your patients, I'm sure, are talking to you about
Absolutely.
it. Now, if you want more information, you can always go to their website, seasonsobgyn-sc.com, and we will keep talking to you about this. And stick with us. More Low Country Live coming up after the break.
Thank you.